And we are live.
We're on. Yes. Hello, everyone. So the SCOME International team and the programs team are excited to welcome you to our first webinar about the SCOME-related IFMSA programs. For 2 years now, programs have become one of the bases of IFMSA work that are increasing our impact worldwide. We decided to host this webinar to give you a better idea about the program structure and how to enroll your relevant activity under them, and especially to go through the SCOME-related ones, medical education systems, medical skills, human resources for health, health systems, and ethics and human rights in health. This webinar will be by the Vice President for Activities, the health systems, program Americas, and will be divided to the what and programs, which general wrap up and questions. So technically, that's it.
Yes, I will share the slides. Okay, so also from my side, hello everybody. My name is Dominic. I'm the Vice President for Activities. That means I'm responsible for the entire program structure, and it's quite an honor to be here with you today to talk about SCOME programs. Okay, so let's dig right in. As Abrish has already said, what we're going to do, and basically I will start now with a little introduction about what our programs. As you know, we have an IFMSA mission statement, and among other things, this mission statement states that IFMSA unites medical students worldwide to lead initiatives that impact positively the communities we serve. I know that's a bit of a fancy language, but all that really wants to say is that IFMSA wants to encourage the members of its national member organizations, the NMOs, to engage in the service to the community, okay? Rather than what IFMSA does itself, which is basically organize conferences on the international level. We don't want our members to be passive subjects. We really want them to do something. And this has been a guiding thought in the foundation of IFMSA. So, okay, now we know what we should be doing in IFMSA. We also have another sentence that's quite important for IFMSA, and it says, think globally, act locally. What does that mean? This sentence basically describes what we should do on which level, okay? IFMSA is a global organization, so naturally it should think globally, but acting, so that means really doing something that is for the local level, because the greatest impact can be achieved at the local level, not the international one. As you know, this would happen with or without the guidance from IFMSA. However, as the international federation we do want this guidance. And in what direction do we want to guide our activities on the local level? Well, this is governed by global health, because IFMSA, as again in the mission statement, it says we want to work towards global health. Okay, so we have to find a way to combine those two aspects, as I've shown here with this balance. On one side, we have global health, okay? This is what IFMSA engages in mostly, and what it does. We do capacity building on the topics that are most important for global health. We organize about 13,000 exchanges each year, enabling students to see other health systems. We have external collaborations, all of which really want to guide us towards what's most important for global health, so on an international level. On the other hand, the biggest impact that we have, the biggest impact that they have is on the local level, as we said, we have here concrete interventions, we have a contact to the community, and we have a so-called snowball effect, okay? So when we empower somebody to do something, that person will empower another person, and that person then another one. And although we start this process on an international level, we cannot, this is only one small part of it, while the biggest part of it is actually part of the local level, okay? And IFMSA programs, they seek to combine those two measures. They seek to combine this global perspectives and what NMO members does on the local level, and actually what change those local members can bring about. Okay, I'm sorry I've not had a chance to present that because of technical issues. I'm just going to go back. So this was this slide with the think globally, act locally, and this was the IFMSA mission statement that I showed before. Okay, so now, as you know, those local actions by IFMSA members, that has happened ever since IFMSA was actually founded, which was in 1951, and they were called different things. They were called initiatives, they were called interventions, they were called projects, and as I said, they are as old as IFMSA itself. Before programs, there was a structure called the Project Support Division. Projects at that time were, again, local actions by members of NMOs. However, the whole administration around projects was quite busy and quite bureaucratic. Projects had to be adopted by the plenary at the General Assembly. They had to submit various reports. They had to apply to be affiliated, and so on and so forth. There was also not really a central source of information about the outcome, so what those projects actually achieved. Now, in 2014, there has been a big IFMSA reform. For some of you who are watching today, you might still know that. There was a process called the Big Four, and those four elements really changed IFMSA. We had the strategy, so a strategic plan for the entire federation, the secretariat to ease the administrative burden on IFMSA officials. We had a new leadership structure that is now elected for the second time, and we had the programs. Again, all of those four elements were really as a mean of IFMSA to think strategically. So, and programs in that sense, in particular, they grasp what impact IFMSA has overall. So basically, we try to see what is it that everybody, all members of NMOs are achieving on the local level. However, when look at it combined. So what is happening? What is happening with everything? What is everything? Not just one little part. Okay. So what is an activity? We have talked a lot about that. We have also said that there were different words to describe that. However, now we call what you do on the local level an activity, and this is basically everything. So everything that members of NMOs do with an impact on a group of people, any group of people. Okay, there are different kind of activities. There is capacity building activities where we provide skills to medical students to actually better achieve that positive impact. Then there's education, where we want to inform people, people that you interact with your activity, to something to bring about the change that you desire. Okay, there's advocacy, where you attempt to influence decision makers to change regulations in favor of your change. That is something particularly important for you and SCOME. For example, when you want to change the curriculum. There's campaigning, where we combine advocacy, so towards decision makers, and education. So this is also towards the people you interact with, for example, the general population, or so forth. There are also other activities that are not so common in IFMSA, but nevertheless very important. You can do fundraising, where you collect money for other parties and support them to bring about a change. There can be also administrative work that you do for another party. For SCOME, this is not that relevant. But for example, when you have blood donation campaigns where you support a blood donation agency as medical students, that is an administrative work, and that is also an activity. Okay, so when you go here, each activity has a set of variables. So that means each activity has some things to it that make it an activity. First of all, we have a problem statement. So you need a reason to do your activity, because otherwise there would be no reason for you to actually do this activity, and you would be kind of, you would do something that is not a problem. So this is really something you need to reflect on. Why am I actually doing my activity? Okay. Then you need an objective. Okay. You do want to change the situation that you described in the problem, and this is what you define in your objective. So the change you want to bring about. Okay. Then something very important is your target group. So actually the group that you interact with during your activity. Okay, the people you work with, so that is not only the people who conduct it, but also the people you talk to, the people you give something to, and so on and so forth. The beneficiaries. The beneficiaries are the people that benefit from the change that you want to bring about. This can be the target group. For example, if you give some resources to a marginalized group, then the target group is the same as the beneficiary. However, for you in SCOME particularly, beneficiaries are not always that apparent. Consider this: if you improve medical education, you will, of course, very much benefit future patients, because they will profit from you knowing and having better skills, having better knowledge, and so on and so forth. So that means beneficiaries are not always the first that come to mind. However, you really need to think about them so you can have a good activity. And in the end is the intervention and the researchers. So what actually happens? What are you actually doing? Are you distributing flyers? Are you going to school and talk to students? This is something that, of course, you need to do. If you don't have the resources to do it, this is also not really working. So this is the last step kind of that you need to take into consideration. Okay, so I have here, sorry about that. Okay, so here you see, oh my God, I'm really sorry. Okay, so here I've had a example of an activity. This is something, again, about medical education, because we're here in the SCOME webinar. This activity that is described here, the problem statement is that most medical education happens in very formal settings. It's very topic-based rather than problem-oriented. Okay, and your objective would be to show a group of students a different form of learning by presenting a clinical case from the start, so from first manifestations to diagnostics, identification, treatment, and so on and so forth. Now, again, you have to think about who do you really want to benefit, and that's, of course, the medical students, because they have an easier learning, professors, because they better know what are the needs of the medical students, but of course, again, as I mentioned, the patients, because they will eventually receive better care by students learning better. Now, the action itself, however, is not on the patients. It's also not quite on the professors. It's really on the medical students, because they receive your teaching and they receive a better form of learning. And of course, now how you do that by the intervention or research, this is up to you. For example, this is an activity that that will be presented during the activities fair in the upcoming March meeting 2017. Here they're showing medical students episodes of Dr. House, and they discuss it afterwards with professors. I've listed some resources. I think that's quite obvious. You need a DVD, you need a DVD player, you need an auditorium, you need a professor being present that will discuss the case with you, and so on. Okay, now we've talked mostly about activities. However, this is a program webinar, so how are activities and programs linked? Okay, a program is a stream of activities working towards a common end goal. They are coordinated by a program coordinator, which is appointed by the IFMSA Executive Board every year. We have 18 programs. As we said, for SCOME, there is about 5 that are closely related to the SCOME field of work. Okay, now what does that mean? We have a stream of activities working towards a common goal. Again, consider this. We have on one side the global perspective of IFMSA, and on the other hand, we have the local impact that is the greatest. Okay, programs, they provide a framework in which this local action is sorted into a logical framework of what will happen and how change can happen. Okay, this is quite a complicated theory, and I admit that. It's called the theory of change. We're not going to go through that because this is something that, if you're very interested, please approach us, but not something that relevant now. The essence of it is the following. You cannot reach an end goal at the first glance, okay? You first have to achieve some intermediate outcome before you can attempt to reach an end goal. Okay. Now, if you want to plan this efficiently and to actually, if you want to reach that end goal, you have to determine which steps you achieve so you can actually better distribute your resources, you can better plan, and so on. And how do you measure if you have achieved an outcome? This is done by so-called indicators of success. Indicators of success, they are surrogates that tell you, okay, I've achieved something, and now I can move on to the next step so I can reach the end goal of my activities, okay? Indicators of success, as I said, surrogate, this is something that can be measured, so a number mostly. This is not something that you just describe, this is something actually you count, and that gives you a sense how far you've come. Okay, many of you will have heard of the SMART goals, and as you will remember, the second letter, the M, stands for measurable. Okay, and this is all that really indicators of success are. They seek to measure your success, and therefore, if you have SMART goals, you have goals that you can measure. Okay, if you have not SMART goals, that means you have not measurable goals. That means you won't even know if you have achieved something. Okay. Now, I know this has been quite theoretical, so let's show you how that looks, how that works in practice, okay? Imagine that you have a baseline, okay? So you have really baseline of what you have. Let's say this is a first-time attendee in your SCOME sessions at a General Assembly, okay? No experience whatsoever, first GA, you don't know, that person doesn't really know what to do with his time and wants to do an activity, okay? Now, this student sees that in the curriculum of his or her medical school, there's basically no global health topics at all, okay? So this is really concerned, very classic, with diseases, with symptoms, and so on, but nothing about, yes, how are health problems interconnected? What causes health? How can we influence this? And so on and so on. Okay, so so that student would like to change that, okay? He or she would like to integrate those topics in the curriculum. Now, if you know yourself, if you send that student back home and ask him to do that straight away, that will not really work out because neither does he or she have the capacity to do that, neither does he or she have the access to decision makers to do that, so that won't really work. Okay, this is why you should set intermediate goals, so steps that you need to achieve so that you can actually reach to your end goal. For example, imagine that this first time SCOME attendee, okay, he has that end goal in mind, but okay, he puts it back in his mind and looks, yeah, how can I achieve that? A first step, for example, could be to be trained, okay? And as you know, in SCOME, we have the TMET that helps you learn techniques that are very important, for example, if you want to engage with medical schools, okay? So once you have reached that, you can reach to another level, okay? Which is, for example, that you as a medical student are part of a regular body that revises curricula, okay? And once you are in that body, you can actually propose, okay? But of course, again, I hope you understand this. You first have to be part of the body before you can actually propose a change, okay? For each of these steps, as we have said, there is an indicator of success, okay? So for example, if you have the TMET, the number of TMET graduates will indicate you how overall, so in all NMOs, you have reached the capacity that you need to do, for example, to have access to those bodies. Then, if we have the second intermediate, if we have the hours of attendance of students at such curriculum revision bodies, you will know how likely those students will be able to give their input and to have actually bring about a change. And only after that, you will measure how many times students have actually been able to change the curriculum, for example, to include something about global health. Okay, I hope you could explain that to you in a bit of a practical way. I know this is a bit of a theory, but nevertheless important. In closing, I would just like to tell you how the process is. So specifically, what should you do to actually enroll your activity in a program, okay? And this is something called activity affiliation, which is basically nothing else than making an activity part of a program, and thus it will be considered as a part of the action working towards the common end goal, okay? This is a two-step process. So the affiliation is a two-step process. You have first the so-called enrollment, where you basically make yourself known to the program coordinator of your program. The very great benefit of that is that you can actually tell your program coordinator, so okay, I would like to do this, 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 and this, and the program coordinator, because he or she is an experienced activity coordinator, will be able to tell you how you can optimize your activity design. Okay, it will also ensure the support of your NMO, because your NMO will actually sign and stamp a candidature form for you, and will be aware and can thus connect you to IFMSA better. You can enroll in your activity at any time, okay? For example, if you feel very confident that your activity has really been a great activity and has worked towards the common end goal of the program, you can even enroll after you're done. However, if you would like to have help from the program coordinator, we strongly advise that you do that before your activity takes place. About 4 weeks are perfect. Then, after your activity is done, the second step follows, which is reporting. And here you really say, okay, I've had this, this, and this goal. I have actually achieved this, this, and this, okay? And there you actually have to rely on the indicators of success that you are putting forward in the enrollment process. So for example, in the enrollment process, you say, okay, I'll measure my success, how satisfied participants of this TMED were with its content, okay? And then in the reporting, you say, okay, so 80% were really content, 10% were okay, but they would have made some improvements, and 10% found it horrible, which we of course don't hope. But this is then the reporting, and this information really is important because this will be included in the annual impact report. Okay, and as we said, this of course has to be done after the completion of the activity, otherwise you will not know what you've actually achieved. Okay, just to show you a bit how that works, we have for enrollment an enrollment form. We have now very brand new one enrollment form for all IT programs, and in this enrollment form you basically fill out all the variables pertaining to your activity. So you name your problem statement, you name the target group and your beneficiaries, you name your objectives and indicators of success, you mention your methodology, so actually what are you doing, what is your intervention. You also are asked some information that are important for us, the program coordinators. So how relevant is your activity to the program? What is the expected help that you, what help do you expect from the PC? Do you collaborate with external partners? And so on and so forth, okay? Something that is brand new as well, and something very important also for SCOME is for long-term activities. So for activities that are really there every year in your NMO that you've done for the last, I don't know, 10 years, you will now be able to enroll only once in a program, and then not enroll every year, but just report every year, okay? Previously, it was considered that if you want to be included in that year's program report, you have to enroll every year. It's no longer possible, okay? If you are in a continuous activity, submit the enrollment form, let the PC know, and then we can actually get in contact with you to ensure that you are part of the program for multiple terms at a time. Okay. Also, don't forget, you have to submit a candidature form. It has been updated a bit. You have to have your NMO president sign it or an authorized member of your NMO. There's a link in the enrollment form that will show you which NMO members can also sign this form for you. Yes. Important, 2 weeks after you've submitted the candidature form that you see on this slide and the enrollment form from the previous slide, you will hear back from the PC, and you will have the decision whether you have been, whether you will be affiliated with the program or not. Lastly, about reporting, this is done with separate Google Forms. There's a separate one for all 18 programs. There you will really be asked about statistical data. So how many medical students have you achieved? How many, for example, in the Teaching Medical Skills program, how many have taken part in your courses? How many curriculum changes have been implemented in your medical school? And so on. This is to be filled out after completion of the activity. And actually, the PC will give you that link. That link doesn't just fly around somewhere. And this is just to ensure that we only have activities fill this out that are actually enrolled. All activities that are reported before the 15th of June of any year, they will be included in the program annual impact report that again shows what an IFMSA NMOs have worked on this program's topics over 1 year. Okay, this is very valuable information for us because, if, for example, we can use it in external representation, we can use it for finding funds, and so on and so forth. This annual impact report is adopted by the General Assembly at August meeting. So I think that has been everything from my part. Thank you very much, and I'm now handing over to Mohsna, I think.
Can you hear me? Hi, hello guys. So I'm Mohsna here, but you can simply call me Ma. And I'm the Medical Education Systems Program Coordinator. This program was adopted in March meeting 2015. So let's start with why medical education systems? Why do we need this program? So medical students are, as the major stakeholders of medical education, are often excluded from participating in their educational systems, or they quickly become demotivated to do so for several reasons. And besides, and most importantly, students are unaware of their rights and responsibilities, which leads to their passivity, student representation, and decision-making in medical schools. So now, what is the main goal of this program? This program aims to create a platform where medical students will learn about medical education systems and students' meaningful participation in faculty decision-making. These skills will hopefully empower them and incite them to take a leading role and actively advocate their inclusion in decision-making. This program's focus areas are training on medical education topics, assessment of medical curricula and education in general, integration of internationally recognized proposal to the curriculum, integration of global health in the curriculum. So, as the picture says, these programs believe that your voice as medical students matters and that you have an important input to your medical education systems. This is why you should be included and you should be advocating to get more involved. So the target groups and beneficiaries of these programs are, first of all, and most importantly, medical students, but also medical faculties, local and national organizations, institutions, student councils, international organizations which work on medical education. And then examples of activities that have been enrolled or types of activities that can be enrolled: training medical education trainers, aka TMET, career guidance colloquium, management course, training on non-formal education or curriculum development, or any kind of activities and type of activities that works to advocate to the students' rights or works to empower students and help them get more involved. So that's it. And if you have any questions, please don't hesitate to contact me through my email, med@ifmsa.org. Then I will leave you with Maria.
Okay. Hello, I hope that you are hearing me well. My name is Maria and I'm Program Support Assistant to VPA and also Program Coordinator to Ethics and Human Rights in Health Program. And today I will be filling also for Teaching Medical Skills Program Coordinator. This is a program, one of the first SCOME-related programs which was adopted in March meeting 2015. And why do we need TMS? Basically because students often experience that the practical skills are not encompassed deeply enough in medical curricula, and as well the education on practical skills is often unstructured and unspecified. Teaching medical skills also involves which students would acquire spontaneously as it is assumed within our medical curricula. No, it doesn't always work that case. Therefore, the main goal for teaching medical skills program is to improve the competencies of the future doctors and improve their medical skills so they can fit the needs of the societies and take better care of their future patients. When it comes to focus areas, we have 5 focus areas, starting from competency-based workshops and trainings, and then regular self-assessment of skills opportunities, that is more an advocacy-based effort. Then we have acting in emergencies, such as basic and advanced life support and emergency care trainings. Then we have medical students who advocate for the inclusion of such workshops to medical curriculum, and communication skills. For target groups, of course, the target groups are medical students and medical faculties who are preparing such workshops and are advocating for the inclusion of such activities to medical curricula, and the future beneficiaries will be the patients and the public health systems. Examples of such activities, we have medical skills workshops, which involve surgical suturing, orthopedics workshops, summer schools, seminars, and safe injection practice workshops, basics of physical examination, and ECG workshops. These are the examples of the activities that were enrolled here. And of course, we have also reacting in emergencies, so basic skills in emergency medicine workshop and doc-to-doc workshop. Workshops, so as we discussed previously, a little bit of soft skills and medical skills combined. So some language workshops, for example, Polish in medicine, which was involved. And now, Dino.
Yes, hello everybody. I'm Dino. I'm the development assistant for SCOME. And I'm speaking for the program coordinator of Human Resources for Health. You can see his name and his email if you want to contact him. So Human Resources for Health was adopted in August meeting 2015. And I put 3 boxes with huge numbers on the slide that should make you aware of the issue we are facing. The first box, 1 billion. This is the number of people who are not, who don't have access to a health worker today, or have never had access to them. 4.3 million are the health workers. That includes doctors or nurses, etc., that are needed today, and 8.5 million are the health workers, is the estimated number of health workers that will be needed by 2025, according to WHO. So basically, Human Resources for Health is a program for startup of local and national activities that tackle health professional issues at several levels. For example, medical education quality, availability and accessibility of health workers and professionals. In fact, not many NMOs have active activities or projects in this field, and in many cases they are not tackled by, this field is not tackled by many NMOs. And having this in mind, the Human Resources for Health program tries to develop platforms regarding this topic and increase the impact of our federation internationally. And one important focus is also that many different regions have different problems and needs. So at the moment, there are 3 main needs that are established. We have to ensure a high-level training and education to the future health professionals, then ensure availability and accessibility of health workers all around the globe. And this is also connected to the last point, to avoid global and regional inequalities. Yeah. So the next slide are the program areas. We have 3 main program areas: the scientific, information, and external representation area. A scientific area deals with the pedagogic conditions and prospective studies of health professionals' needs. Then information area, we have campaigns within the community and motivation and campaigns among us students, and activities concerning the problems of human resources for health. And then, of course, we have the external representation areas. So all the meetings, conferences with key stakeholders in order to influence the decisions relevant for human resources for health matters. So on the next slide, we see examples of interventions. You can, for example, collect attitudes of medical students towards migration. You can research working conditions of healthcare people in your country, and you can advocate for incentives for healthcare workers. So the examples from the last term, we have only one activity. I hope that will change for this term, which is the coaching memorandum of IFMSA Pakistan, if you want to contact them. And there were several international external meetings and campaigns, and I just took this one as an example. The UN High-Level Committee on Health, Employment and Economic Growth, and our liaison officer for WHO and for medical education attended this. And then we have the target groups on the next slide and the beneficiaries, which are, of course, healthcare students, international organizations, universities, also national health ministries, and professional regulatory bodies. And this leads us to the last part of this program, the end goal, which is the change of planning of human resources for health. And this should lead to a quality and transformative health education, and should also empower our animals to participate in the discussion. So now it's the next program.
Okay, so the next program, Ethics in Human Rights and Health. Hello again, my name is Maria, and I'm Program Coordinator for Ethics in Human Rights and Health. This is a program which was adopted in August meeting 2015. First of all, many of us primarily mistaken this program for being more SCORP than SCOME, and I would like to persuade you a little bit that it's actually half and half. Why do we need ethics and human rights in medical education? Basically because both medical ethics and human rights are the guiding values, and future healthcare personnel must feel confident to take ethically sound decisions and advocate for their patients in all settings. So therefore, we need to know our roles, rights, and responsibilities should be included within our medical education. So the main goal of this program is for medical students as future physicians to be able to question our professional behavior and decision-making, and answering by ethical and human rights principles regardless of the situation we will encounter. So as for the focus areas, this program is very broad. We have 5 main focus areas, starting from human rights for medical students, then good medical practice and communication in healthcare for specified groups in terms of communication, also for critically ill, vulnerable groups and minorities, as well as cultural and gender diversity aspects in communication, rights of patients, healthcare and medical students, and corruption in healthcare, meaning ethical research and ethical funding. As for the target group and beneficiaries, target groups are mostly medical students, medical faculties, but also healthcare students and other professional organizations, as well as international and national policymakers. These, of course, our patients and vulnerable groups, as well as healthcare providers and medical students. And we have a bunch of examples of activities. As for human rights and medical ethics, last year there were enrolled training on human rights and the influence of religion, tradition, and conflict in healthcare, as well as marathon of writing letters for Amnesty International. We had human rights and medical ethics, ethical codes for medical students, and Doctors Project, which is an online platform to discuss impact of human rights, ethics, and humanistic sciences in medicine. Had good medical practice and communication in medicine. There were few communication For example, breaking the silence workshops on sign language. Then we had Thank You Doctor. It was a campaign for strengthening doctor-patient relationship. And we also had an Angel for the Ends on how to deliver bad news and soul therapy trainings, and the Clown Doctors workshop. Next was, as for cultural diversity aspects in healthcare, we had Embracing Diversity project, a peer-to-peer education on medical and cultural aspects of medicine, as well as for rights of patients, healthcare, and students. We had Law and Patients' Rights in Healthcare workshop, Enrolled, project lecture, and law-related topics discussions in medicine. From my side.
Okay, then it's me. My name is Lizana, and I have the pleasure to introduce you to the health system program. The health system program is a really broad program, but really interesting. And as health system is such like an abstract term, I will try to briefly explain it to you. Because a health system consists of all organizations, people, and actions who promote, restore, and maintain health. So it's quite broad. But let's imagine we have a population, and we can look at the health of these people on an individual or population level. For example, like, do the children die young, or how many women get unwanted pregnancies? But we can also look at the system, as the system itself can cause that the people don't receive the care they need. For example, because we don't vaccinate the children for the relevant diseases, or because the health workers are not allowed to perform abortions and there's no safe alternative for the woman. Or because not all the people receive the care that they need. For example, when vulnerable groups are systematically excluded from the system, or because people live in rural areas where there are no health services, or because people can't pay for the care that they actually need. So, what do we need to have a good functioning health system? I hope you can see now that there are like six boxes. And first, we need, of course, like health services in a health system, and services which deliver like good care, but also to the people who need them. We need a good health workforce, and you already heard a lot about that. We need a health information system which tells us information about like the health determinants or the health status in the population, but also about the performance of the health system. We need access to medical products, vaccines, and technologies, and all of it with good quality, but also cost effectiveness. And we need a good health financing system, and that's really important to ensure that the people can use the services and are protected from financial hardship. And we need good leadership and governance, which includes strategic policy frameworks and effective oversight and also accountability. Okay, now we go to the next slide. Because unfortunately, the health systems do not meet the requirements of the people, which can be due to a failure of many different factors, but mostly one out of the 6 that I just mentioned. And second, medical students lack the knowledge and awareness around the topic, which prevent us, the medical students, from acting within our society. Well, with this program, we have 4 different objectives. First is participation of medical students in the decisions that affect health systems. And second point is medical students influencing the policies on a local, national, or international level. Third is to increase the access to quality health care with actions that medical students can do, again, in the local, national, or international level. And last but not least, which is mainly important for you guys, I think for SCOME, is to be an educational platform for medical students on health systems, on the determinants and the factors influencing the accessibility and the quality of healthcare, to develop skilled and empowered future physicians. Well, if you're thinking about organizing an activity within the health system program, you can do an activity which is related to the system as a whole, but you can also choose to do it on specific focus areas. So, for example, you can choose to do it on rural health. You can choose to do it on trade and health, or with a focus on universal health coverage. And universal health coverage is one of the goals of the Sustainable Development Goals, which is aiming for a health system in which all the people and communities can use the care which they need with good quality and without suffering from financial hardship. You can also choose to do an activity more focused on global surgery. And global surgery is focused on sufficient and good quality surgical care around the world, or on primary health care with a focus on health systems then. Since the role of primary health care within health system is really interesting because primary health care can cover a lot of the health needs of the people. And last but not least, access to medicines. To ensure that we all have access to the medicines that we actually need. Well, then there are a lot of different activities that can be enrolled under this program, and they vary a lot, also because the health systems of all the different countries vary a lot. But to mention some examples, last year we had a toolkit on global surgery, which was written by several NMOs. We had IFMSA Morocco, which organized a project, an activity on medical caravans, in which they, together with doctors, went to rural areas, and they provided free medical consultations, exams, and medication for the people who needed it. And they raised awareness about rural health amongst medical students by doing this. And they also raised awareness about rural health with articles and news stories in the press. And last but not least, we also had IFMSA Australia, who organized a 2-day conference for medical students with academic, breakout, and network sessions. So if you're thinking about organizing an activity in this field, or you would like to have some more information, please contact me by healthsystems@ifmsa.org. And then I now give the word to Pablo.
Thank you very much. So hello, everyone. My name is Pablo Estrella. I'm the actual SCOME Regional Assistant for the Americas. And past term, I was the National Officer of Medical Education. So as know me, in Ecuador, we didn't implement programs till last year. So I started implementing the programs in our national activities. Our first project, which was enrolled under the Teaching Medical Skills, and was a project based of how to take vital signs. We teach that to first-year students, and then show them to the give to the population the opportunity to have free access by medical students that give the service for free. So when I enrolled the program, it was really useful as activity coordinator to see which benefits the enrolling the program can give to us. So first of all, when you fill out the several documents you have to do, you give the feedback from the program coordinator of how to plan the activity and how to evaluate the activity. Sometimes when you are pretty new in making projects, you are not quite sure how to give quality assurance in your activities. And having this feedback from the program coordinator was really helpful for improving my first activity, which was enrolled under the program. You will be wondering what benefits can enrolling your programs give to you. First, it gives you bigger impact. So whenever you are gonna show to any authority, you're gonna show to I don't know, to any people about your activity, it's really important to make the point that your activity is supported by IFMSA, that the activity you are making, for example, this one that I was telling you, was enrolled under the Teaching Medical Skills program and is under all this framework that gives you the support from IFMSA, but also gives the impact worldwide from several activity coordinators that work together. Also, as I was saying, you have the support from IFMSA for the pictures. So, for example, you can promote your activity with the IFMSA logo. You can use also the IFMSA logo for saying that your activity was supported in the certificates. But also, another thing that it's really important is to say that you can start cooperating within with several NMOs. How? Once you give the report to the program coordinator, you can see which other activities are making all over the world. So if you see that, for example, there is an activity that is happening in Pakistan that was already enrolled, and it can be replicated in your country, you can contact the program coordinator, ask for the contact, for the email, and write to that activity coordinator for replicating that activity in your country. And finally, it's also when you enroll the activity, you will have the experience to contact members from IFMSA, international members that have a lot of experience because they have worked with several NMOs, they have worked with several types of projects and activities. And having this is also an opportunity for giving local officers, national officers, or any activity coordinator the opportunity to be more involved under the IFMSA network and to start working with more internationally. Finally, as RA, I'm trying to promote in the Americas all the enrollment of activities under the IFMSA programs. And as you have seen, there's actually 18 programs that you can enroll. And I'm really thrilled to start working with national officers. And as you see, it's not difficult at all to start enrolling your activities. So I really encourage you. And it's a great experience as activity coordinator. So I will lead the word to the next. Thank you very much.
Thank you. So, hi again, guys. Now let's go to the big question. Why to enroll your activities? Why should a local coordinator, activity coordinator, or a national activity coordinator enroll its activities? I will add a few things to what was already said. So first of all, by enrolling, you will get IFMSA recognition and certification, and you will also get the international promotion of the activity through the publication of the annual impact report. So these 2 points will actually enable you to have better opportunities to receive support from the authorities, to find external partners, and to fundraise through IFMSA, through like the recognition and the use of the IFMSA logo in promotion materials. Also, programs will provide you with the guidance and support of program coordinators. So you can actually always go and ask them for help if you need so, or for materials for your activities. In the other hand, enrolling will enable you to participate in international IFMSA initiatives. And also, as was already said, being part of IFMSA programs will help you to collaborate with other animals from all around the world who are working in the same area of your activity. And finally, programs enable you to have better capacity buildings with training toolkits, sessions, workshop meetings, which will help improve the quality of your activities, and also which will help to empower your members, your animal members. So that's kind of it. And thank you. And then I will leave you to the last part.
Thank you, Wahsna. So does anyone have any questions that you want to ask to any of the program coordinators or Vice President for Activity or the SCOME International team? Like, you can write the questions on the YouTube page as comments. No questions? Okay. Yeah, we have one question. Just a second.
I'm so waiting for the question right now.
Yes, I think they're still writing it. It's for ethics and human rights in health. So we will wait for them until they send it, I think. Okay, so the question is, in the SRT trainings, are there panels or trainings for medical advocacy? And how do you prevent overlap with SCORE? So, Maria, do you want to answer?
Yeah, sure. I mean, first of all, I think that SRTs are a little bit different things. In programs, we are focusing more on the activities that are, of course, national, international, but more not on the trainings, SRT trainings per se. And of course, it depends on what kind of medical advocacy that would be. So if it would be a training like, for example, human rights for medical practitioners, which involves medical ethics and human rights, then it's possible for this training to be enrolled within the programs. What I think that we didn't mention yet is that IFMSA programs are a little bit different from the standing committees in the sense that they are the kind of for our activity coordinators, for members of IFMSA, to get more information, more knowledge and skills in this. And as for the standing committees, as we know, standing committees are very broad within the structure. So I think that this is the main difference, and I think that we won't be overlapping in the sense, because programs are working within the standing committees and like with standing committees, and we are like working together on all of those topics related to ethics and human rights. Thank you.
Thank you. We have another question from Daniel from IFMSA Peru. His question is about the certificates that an IFMSA program will give to participants of an activity. it means the enrollment certificate or support letter. Will it be international, and how can we get it? I want to answer this question.
Yes. So it's just to explain that a bit. This is not something that has been initiated yet, but we're in the process of starting it right now. Reason for it being that we've never had really an overview of all enrolled activities. However, with the new form and with the new spreadsheets that we have, this should now start. Just to clarify though, that there will be a certificate per activity. So basically there will be a certificate like this activity has been enrolled under an IFMSA program. It's not that an individual member would get the certificate because we have no means of tracking who participates in this activity. This is something that you would have to approach your activity coordinator or then the national officer or even your president to certify you with. Then, for example, you could send both certificates. So this is how it is.
Thank you, Dominique. So I think we don't have any more questions. Thank you everyone for attending. I hope that this webinar has been beneficial for you. Still, if you have any questions for any of the IFMSA program coordinators, we will have a follow-up email after this webinar with the webinar link so you can watch it again and with all relevant information you need. Thank you all for all this webinar, and goodbye.